Good day everyone and welcome back to my YouTube channel. In today's video we'll be treating depression. But before that, if you are new to my channel, I'm Miss Martin Abwini and I discuss everything health. To my returning subscribers and viewers, this is me saying thank you for sticking around. Please, if you've not clicked on the subscribe button or the notification bell, please don't forget to do so before we proceed. Okay, so let's go over to the topic of the day, which is depression. What is depression? Depression is said to be the presence of low mood which is persistent for 2 weeks and above, and also interferes with your activities of daily living. You have to bear it in mind that depression is different from being sad or being frustrated or being angry over something which does not last long. For instance, if you had a loss or something happened and you are sad, it's fine to be sad, it's fine to be angry, okay? But when it lasts more than 2 weeks and it interferes with everything you like or things you normally do on a daily basis, then it is considered as depression. Okay, so what are the signs of this depression? There are many signs ranging from sleep disturbance. It's either you're sleeping too much than you normally do or sleeping less or not sleeping at all. Changes in appetite, either to the high side or to the low side. Weight changes, either you gain weight or you lose weight. So this depends on how much you eat as well. Probably if eating much, then you're likely to gain more weight. But if you're eating less or not eating at all, then you're likely to gain less weight. Being frustrated, irritability to things that normally don't irritate you, low interest in things you normally do, that's your hobbies, suicidal thoughts or suicidal attempts, feeling of frustration, low concentration, etc. So what are the causes of this depression? The causes of depression are said to be unknown, but there are some risk factors associated to having depression, ranging from genetics. So if it runs in the family or anyone in the family has had it before, you're likely to have it. Then the next is what we call biological changes. Research has proven that in people who suffer depression, there is a presence of decreased frontal lobe size. Okay. Then the next one is chemical brain changes. So there are some chemicals in the brain that we normally call neurotransmitters. If there's an alteration in the secretion of these chemicals, this can lead to depression. Example of these chemicals ranges from serotonin, dopamine, norepinephrine, that's noradrenaline. Okay. Then the next one is hormonal imbalance. Example of this hormonal imbalance is when there is a problem with the thyroid gland leading to thyroid deficiency or thyroid dysfunction, where there's too much thyroid hormone or less. It is classified under this hormonal imbalance. Then physical or emotional distress. Then the effect of certain medications such as antihypertensive, that's the medication you use to control high blood pressure, and some sleeping pills can cause depression. So if any of these above listed factors are present, you are likely to develop depression. So having known the possible risk factors and the symptoms of this depression, how do you actually diagnose depression? So it is said that in the presence of any of the above listed signs and symptoms, depression is present until proven otherwise. So if you're having 5 of these symptoms, you need to see your doctor, who will conduct some evaluations and get to the final conclusion of what is actually wrong with you. What are the diagnostic measures or diagnostic means? One, we have physical examinations, lab tests to check for hormonal abnormalities and to also rule out thyroid dysfunctions. Then we have psychiatric evaluations, where your doctor have to have some conversations with you, study your thoughts, if you have any suicidal tendency. At this point, he or she is going to rule it out. Then the next on the list is what we call the Diagnostic Statistic Manual of Mental Disorder. So after the diagnosis of depression is being concluded, that leads us to the treatment of depression. There are three main treatment regimes for depression, ranging from the use of drugs, psychotherapy, and what we call the brain stimulation therapy. So examples of drugs that can be used in this treatment is selective serotonin reuptake inhibitors. So in this category of drug we have the citalopram, okay? Then the next one is atypical antidepressant. Next is tricyclic antidepressant. Then we also have what we call the monoamide oxidase inhibitors, okay? Then the next category is the use of psychotherapy, where you have to see a psychotherapist to start a section with him or her. The last but not the least on this is the brain stimulation therapy. Examples of this therapy: electroconvulsive therapy. So in this therapy, an electric current is being transmitted to the brain where the neurotransmitter secretions are being stabilized. So what are the possible complications of this disorder? We have social isolation, because people with depression tend to withdraw and stay on their own. We have suicidal attempts, which, if not prevented, can lead to premature death. Then the last but not the least on my list is drug or alcohol misuse, okay? So please, if you're experiencing any of the above listed symptoms, do seek help, okay? Try to talk to someone about it. You can visit your doctor if you don't want to talk to a friend about it. Please do not die in silence, because it can be treated definitely, okay? So this brings us to the end of today's video. Please don't forget to like, subscribe, and share the video if you found value. And don't forget to pop your questions or any topic you want me to talk about. Thank you, and see you in my next video. Bye bye.